So, honorable chairs, dear colleagues, thank you very much for the opportunity to speak here. It is wonderful to see the response, to see so many colleagues of us joining here. And first of all, that's it. First of all, the obligatory duties. There are no conflicts of interest. Dear colleagues, dear ladies and gentlemen, the tropics are the literal hotspot of the world's most venomous and poisonous species, which at the same time are some of the world's most wonderful creatures. An old tradition of mankind to understand things better is to tell each other stories. This is what people did in the old times, and this is what we do at this moment to educate us in guidelines and to handle situations better than in this case here. Most snakes escape whenever they meet us, but some can't, as they suffer either from stiffness in the early morning cold or feel trapped for any reason, and bite us in a case of self-defense. The consequences extend from hemorrhagic vesication to necrotic infarction, from loss of body parts to loss of life. What all snakes on Earth have in common are certain characteristics of their anatomy. With their hook-shaped teeth strictly directed inwards, snakes usually arrest their prey firmly and irreversibly, allowing it only to move in one direction, stomachwards. In the maxilla, venomous snakes carry fangs, leading toxin all the way through the fangs deeply into the prey's tissue. Half of the bites of venomous snakes are dry. That means these bites do not carry any venom. Bites like these are mostly performed with just one single fang. This has to be understood as a snake's warning towards disturbers or aggressors. With two additional bones, the maxilla can be prolonged and stretched forward over the prey, while the two separated mandibles can be stretched sidewards, allowing the snake to grab and to swallow prey, which often is many times bigger than the snake itself. There are about 3,000 different snake species on Earth. Too many for 15 minutes, too many to mention. So if you can't keep all the first names of a family in mind, try it with the family name itself. There are three major families among the terrestrial snakes worldwide, which are important to know. The elapids are represented here by this cobra at the left-hand side, or by this black mamba, one of the most venomous snakes of Africa. The family of viperids is represented here by this gaboon viper on the right-hand side at the bottom, and the family of colubrids by this South African boomslang left-hand side on the top. The best way to differentiate elapids, viperids, and colubrids anatomically is to look at their teeth. Elapidae or elapids carry long, rigid fangs at the anterior part of their maxilla. Viperidae or viperids carry even longer fangs anterior, so long in size that they have to be folded inwards after an attack or a meal. The majority of colubrids instead has no fangs at all. Even more, they present small hooked teeth of same size, indicating the non-venomous species among the colubrids. Just a few among the colubrid species present small fangs in the posterior maxilla, conveying a deadly hemolytic venom like the already mentioned South African boomslang. A popular way to differentiate non-venomous from venomous snakes is to classify outer appearance and bite marks. Benign characteristics are supposed to be round-shaped head and round pupils and bite marks of the whole maxillary row made by the uniform small hooked culprit's teeth. While the bite marks are quite reliable, the shape of snake's head and pupils are not at all parameters for safety, as this boomslang you have seen here already several times is one of the most toxic snakes of Eastern Africa, as we will see within the next slides. Elapids in general are most venomous. Viperids are venomous also, and also including all species. And colubrids, finally, are in general non-toxic, except for the already mentioned rear-fanged species, like, for instance, the boomslang with hemorrhagic toxins, leading most often to fatal consequences. The most important family of enzymes you might find in the venom of all toxic snakes on Earth is the group of phospholipases A2, different chemical compositions varying from snake to snake family and changing their mixture even in between the species, leading to a collection of different forms of malfunctions, including cytotoxic effects, neurotoxic effects, myotoxic effects, cardiotoxic effects, and dysfunction of blood clotting. Another enzyme active in all snake toxins is hyaluronidase, leading to increased cell permeability for further toxins. Neurotoxins of elapids lead to respiratory paralysis and to an extremely painful rhabdomyolysis. Neurotoxins are much more often found in elapids than in vipers. Cardiotoxins, as a component of elapids venom, cause cardioplegia with dysrhythmia and cardiac arrest. Skeletal muscle toxins of elapids lead to a myoglobinuria and to an extremely painful rhabdomyolysis. Here you see the main three clinical effects of envenomation after an elapid's bite: cytotoxicity, paralysis, and hematuria with myoglobinuria. Cytotoxins in the viper's venom lead to massive edemas and later to a massive necrosis of the affected tissue. Hemorrhages in viper's venom lead to a disseminated intravascular coagulation and consecutive to a massive internal hemorrhage. Neurotoxins lead to paralysis via an overload of acetylcholine and to a consecutive neuromuscular blockage. Other enzymes like kinins are leading to hypertension and shock. Nevertheless, most of these cardiovascular collapses are caused by panic reactions of the bitten patient. Hemorrhages in rear-fang colubrids lead to a disseminated intravascular coagulation and in consequence to a massive internal hemorrhage, often with a hazardous ending of the story. Out of more than 3,000 snake species worldwide, 600 are venomous and not more than 200 are considered to be medically important. Envenoming caused by snake bites occur throughout many regions of the world, mainly in Asia, but secondarily also in tropical Africa and in the subtropical or tropical parts of the Americas. Here they are a threat to public health, especially in the rural tropics where they are most abundant. Cheap antivenom products flood the market even in resource-poor countries since years now. These products had passed no or little quality standards and have no or little effect against the claimed snake species. Neglecting the lack of quality, even many resource-poor countries are moved to buy these products, and many examples of that you will find in Asia and Africa, where an increase of morbidity and mortality in snakebite and venomations caused by low-budget antivenoms of missing quality tells us a dreadful story. So in 2016, WHO introduced guidelines on production, control, and regulation of snake antivenom immunoglobulins. In assessing the relative risk of each venomous snake species worldwide and the medical need of specific antivenom availability, WHO established two major categories of medical importance. Both categories include highly venomous snakes, but in category 1, they are medically strictly relevant. In category 2, there are not. Envenomation from category 1 snakes needs to provide local clinics with deliverable antivenom or lead WHO to develop and produce antivenoms, possibly missing on the market but urgently needed. In 2017, WHO categorized snakebite envenomation into the category A of the neglected tropical diseases, an important step forward. Antivenoms are the key, the central treatment for all systemic reactions against the snake's venom. Exceptions might be progressive, severe local envenoming of some most toxic snakes like mambas, cobras, and some more, with involvement of half of a bitten limb within 48 hours or involvement beyond wrist and ankle within 4 hours after a bite in hand or foot. The classical production of animal-derived antivenom starts with gaining or milking the venom out of the snake, a business for tough and experienced experts. The venom will be injected then into an animal, mostly horse or sheep. These injections will be repeated in intervals with a slowly increasing but always subclinical dosage of venom, mostly applied 10 to 15 times during a period of 2 to 15 months. If the hyperimmunizing venom is obtained from a single snake species, the resulting antivenom is considered monovalent. Monovalent antivenoms are needed whenever high capacity of neutralization against snake venom is needed, like against very toxic single species, as for instance against the Australian inland tarpan or the African boomslang. If the venom is obtained from 2 or more different species, the resulting antivenom is considered polyvalent. Most of the current antivenoms are polyvalent. Polyvalent antivenoms cover more species of a region and therefore they are usually more efficient than monovalents. Though a mixture, their effect is close to monovalent compounds, but often the given dosage of polyvalent has to be higher. The obtained antivenoms consist of venom-neutralizing IgG antibodies. Compositions of the antivenom can be either made of whole IgG or of IgG fragments. An IgG antibody consists of 3 parts, 2 Fab fragments and 1 Fc fragment. The fragment antibody binding, the Fab fragment, is the region on this antibody that binds selectively to antigens such as snake venoms. Pure Fab fragments are supposed to be much more tolerated by snakebite victims than mixtures with Fc, as the Fc part mainly is responsible for severe adverse reactions against snake's venom, such as cytotoxic side effects caused by direct activation of the snakebite victim's complement system. So what do we have to consider after a venomous snakebite injury? First rule is to calm down the completely frightened bite victim. And very important, to take, if any possible, a picture of the snake. Never cut a wound made by a snake bite or suck it with your mouth. Never compress or strangulate it. Forget everything you might have learned about first aid of snake bites by watching Wild West movies. Smallest injuries of their oral mucosa can bring even the most ambitious first aid helpers into severe trouble. If any possible, an envenomated patient should be sent immediately in a qualified clinic, ward, or institute. Please note, a patient having been bitten by any snake bites in the tropics always is a life-threatening emergency case until proof of the contrary. What can we do for protection? It's quite simple to say. Wear protective footwear covering over the ankle whenever you walk in regions inhabited by venomous snakes. And do never grab or try to catch any snake. So at the end, what is the most important message for taking home? After all, it is him, Asclepius, the father of medicine, the Greek god of healing arts. The man with a stick turning into a snake. To the ancient Greeks, snakes were sacred beings of wisdom, healing, and resurrection. And that is what snakes are standing for in many cultures all over the world. So just be careful, follow what you have learned, and keep on being fascinated about snakes and about tropical dermatology. Thank you very much.